Well, joining me now is another senator who is proposing an alternative health care bill. We can call it an addendum here. We'll talk about that in a minute. Democratic Senator Tim Kaine of Virginia, who, of course, was Hillary Clinton's running mate in 2016. Senator Kaine, good to see you, sir.
Thanks, Chuck. Good to be with you.
Well, let me start. I know we were just switching mics with Senator Collins, so I'm not going to presume you heard everything she said. Yeah. Well, let me give a quick summary. She's very supportive of this compromise deal, believes the president is going to be on board, if not already is, that Senator Alexander wouldn't necessarily announce something if he didn't have that kind of support. So where are you on this? Are you going to support this deal?
Chuck, more than support it, I've worked to try to help make it happen. When in about a day or two after the failed health care vote in July, Senator Alexander and I pulled together a group of 14 senators, Democrats and Republicans, to talk about, okay, when repeal craters, now we have to work together. And we talked about the essential elements of the deal. And as a member of the Health, Education, and Labor Pension, I've done all I could to encourage and support both he and Senator Murray as we put it together. So I'm very, very excited about this because I think it will show to the American public that on an issue that's been controversial, there can be a bipartisan agreement to stabilize the individual insurance market.
What didn't you get? Look, a deal is a compromise. What's the part of this deal that you're most unhappy about?
Well, let me put it to you this way. Here's the way I look at this deal. There were some things that were contemplated to be done within the Affordable Care Act that were not being done. So Democrats weren't satisfied that the president was, and now ultimately suggesting I'm not going to make these cost-sharing payments. So we weren't happy with that. Republicans were concerned that in the Affordable Care Act there were some promises to states that states could be flexible and tailor programs to meet their own conditions, but they weren't happy with flexibility not really being allowed to the degree that they should. So one way to look at this deal is we were able to firm up, as it comes together, firm up that these cost-sharing payments will be made, and we were also able to firm up for the Republicans an understanding that states could, without compromising on the essential health benefits, have some significant flexibility in the way they build their own programs.
I want to ask you about that because some of these, there are going to be folks that argue that you aren't fully protecting those folks with pre-existing conditions, that you are taking healthier people out of the larger pool, allowing them to be put in a cheaper catastrophic only pool, which then, of course, over time could only raise the premiums of those in the sicker and the pool that wants more benefits, that wants some of those things. Isn't that what's happening here? Is that's not going to take place?
No, I don't think so. I think when you see the bill as the language comes together, it's likely to be Thursday, I think you'll see that the pre-existing condition protection is protected. Some states are using a reinsurance, which you understand. You sometimes have to create a backstop for high-cost claims that requires sometimes separating high-cost claimants and having a backstop for them so that
Minnesota
you can bring...
is doing this, I believe.
Alaska and Maine are doing it, and Minnesota has applied to do it, and they're having trouble getting that waiver, and that's one of the reasons we want to make it a little bit easier. But just because you separate people in that way, that doesn't mean people don't get protections. It just means that the backstop in place is there to give both high-cost claimants protection, insurance companies certainty, but then it brings premiums down for everybody else. So this, we will certainly maintain the pre-existing condition protection.
All right, Democrats sound like they're more united around this bill, frankly, than Republicans are. Obviously, there was a leadership press conference announcing this deal. Lamar Alexander announced the deal on his own, not necessarily with Mitch McConnell. So you could see a tonal difference there. Can this bill get through the House? Can it really get through the House?
Well, let's get it through the Senate committee and the Senate first. But the president today came out and said something positive about it. Look, he has taken steps that have undermined health care. And even 2 weeks ago, we were close to a deal, and he sort of poured cold water on it. But today, he said some things to praise the effort underway. And he appropriately, the president was right about it. He said, look, the purpose of this is to stabilize the market for the next couple of years while we engage in a longer-term discussion about, okay, what are the next good ideas to protect people. Senator Bennett and I introduced a bill today, and there are other bills on the table.
Fair enough. Medicare X, am I calling it right? Or should we Medicare 10? It's like the iPhone.
Yeah.
I'm not confused.
It's Medicare X, and the idea is it's like Medicare Expanded, Medicare Extra, but really it's Medicare to buy on the exchanges. So what we are doing is we are directing the HHS Secretary to use three aspects of Medicare: the provider network, the reimbursement schedule, and the ability to deliver a program in every zip code in the United States with a very minor administrative cost. We're directing the HHS Secretary to come up with a policy that meets all the essential health benefits of the ACA that can be offered on the individual exchanges and sold to people who choose it. We would offer it first by 2020 in any region of the country where there's only one or fewer insurance companies. By 2023, we'd offer it everywhere.
Look, I get that, and it sounds like an interesting potential stopgap, but you claim no new taxes at all. You can't tell me this doesn't add to the taxpayers' bill at all. Are you really telling me you're proposing this, it will cover more people and not cost the American government any more money?
Yes.
I mean, do you understand why that sounds like too good to be true, sir?
I understand that you're a smart journalist, and that's a really good question to ask me, but let me give you the answer. We would leave in place the existing network of taxes and subsidies for individuals whose incomes are low. That all stays in place and it doesn't change. But by creating a lower cost option, if people choose it, they'll save money, and that will actually save money on the subsidies that have to be paid. In 2010, when a similar proposal was being floated around and the CBO office analyzed it, they said it would actually bring costs down.
Doesn't this blow up, though, the private market? I mean, I'm sorry. I mean, if you're providing a cheaper alternative, it's called Medicare. I know we're going over time. But you're essentially, you're really, what individual market's left? Why should the private insurance compete with Medicare?
Private companies are doing fantastically well in the group market. They're not short of profits these days. If they're going to pull out of markets, like, for example, earlier this year there was a threat that they were going to pull out of 65 jurisdictions in Virginia. They're doing this all over the country. By 2018, there will be 1,500 counties that either have one company or none. And we're going to start in those regions for a reason. If you're going to pull out, don't expect us to just sit back and have people have no insurance. We're going to come in and offer insurance there. The rollout would have a significant benefit right out of the gate for rural America.
All right, Senator Kaine, I'm going to leave it there.
We'll talk more.
We will continue debating health care, I have a feeling, for quite some time, at least 4 more years, thanks to this new 2-year deal. Senator Kaine, thank you, sir.
Thanks, Chris. See you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.